we will discuss the types of sleep monitoring devices, which are categorized by how much data they collect and whether they are used in lab or at home.
There are four main types. Type 1, lab-based PSG with technician, is an in-lab setup with full monitoring capabilities, while Types 2, home PSG-like device, 3, common home device, and 4, simplest home device, are portable devices commonly used at home. Type 1, lab-based PSG with technician devices are used in sleep labs for overnight polysomnography, PSG, with a sleep technician present. This setup is the gold standard for diagnosing complex sleep issues, especially obstructive sleep apnea, OSA, since it provides the most comprehensive data on sleep stages, breathing, heart rhythms, muscle activity, and more. The involvement of a technician also ensures continuous monitoring and adjustment if needed, so data is less likely to be lost. For home-based testing, Types 2, home PSG-like device, 3, common home device, and 4, simplest home device, are more practical. Type 2, home PSG can record similar data as Type 1, lab-based PSG with technician, but are less common due to setup challenges. Although these devices collect detailed data, they lack a technician, which can lead to issues if sensors detach during sleep.
Type 3 devices, the most commonly used home sleep apnea testing devices, monitor 4 to 7 variables, including airflow, respiratory effort, heart rate, and oxygen levels.
Some models may even track snoring, body position, or movement. While they don't measure brainwaves EEG, which means they can't monitor sleep stages, newer devices may use actigraphy, a motion sensor that estimates sleep and wake times, to help fill this gap. These devices are generally adequate for detecting moderate to severe sleep apnea and offer the advantage of home comfort, where people may sleep more naturally than in a lab. Among Type 3 common home devices, a unique option is the WatchPAT. This wrist-worn device estimates respiratory events indirectly by measuring changes in blood flow peripheral arterial tonometry, or PAT, along with oxygen levels, heart rate, and snoring. Although not as precise as a full PSG, it's validated for OSA screening. The Apnea Risk Evaluation System, ARES, is another head-worn device that measures oxygen saturation, airflow, and head position. Both WatchPAT and ARES have software to interpret results and calculate indices for breathing disturbances.
Type 4 devices are simpler and track 1 to 3 variables, typically oxygen levels and airflow, to assess breathing disruptions.
While easier to use and convenient, Type 4 devices provide limited information, and results can sometimes be inconclusive due to the minimal data collected. Pulse oximetry alone, often classified as Type 4, may indicate drops in oxygen that suggest sleep apnea, but generally isn't sufficient to confirm a diagnosis without additional data.
Generally, for people with milder symptoms or for initial screening, Type 3 and Type 4 home device can be a good starting point, while complex cases may benefit from an in-lab PSG.